Well, good afternoon, everyone. It's a pleasure to see everybody this afternoon here, and we're happy to have you with us. My name is Mark Covert, for those of you that don't know me, and I am the brokerage sales manager with Insurance Advisors Direct. And I hope everybody is doing well considering the situation we find ourselves in currently, but hopefully on the downhill slope. And with that, we're going to spend a few minutes today revisiting the Michigan Medigap subsidy that's been around for a few years here that you may or may not know about. There's still some money left, and that's why we wanted to take a look at this and make sure that you knew about what's out there, how to use this thing, and we'll take you through all of that stuff for those clients that may qualify for this particular program. And as long as the money stays in there until it runs out, it's an excellent alternative for some folks who may be looking for Medicare supplement coverage due to illness or current health status or conditions, and really would like to fix their cost and have a little challenge maybe with the higher premiums. So with that, we're going to kick this off. And I want to start here, and we're going to give you just a little bit of a background on this. So for those of you that are not aware of what this is, back in 2017, Blue Cross Blue Shield came to an agreement with then Governor Rick Snyder and wanted to go into a for-profit corporate type of structure. So in exchange for that, they were required to put about $2 billion up and move towards that platform. And in putting this $2 billion up, it was intended to be utilized for folks who may suffer premium increases as a result of the restructuring and rate changes. Because as we all remember, for those of us that have been around a while, you recall the Blue Cross Legacy C plans that used to be guaranteed issue in the state. Blue Cross was the insurer of last right, and it didn't matter how healthy or how sick you were going to get Plan C from Blue Cross at around $112, which is the last premium that I actually remember. So with that being said, that's how this Medigap subsidy came to being. And it's actually a very simple program. This is who qualifies for this particular program. And you do have to be a Michigan resident. One of the things that is going to occur here is if you're splitting your time between Florida and Michigan and you're a six-month type person, they are going to ask you to somehow document that. And in particular, it's probably going to be the driver's license and or maybe a voter registration card. So just let your clients know that if they do have a Florida driver's license, even though they live here, there may be some hoops to jump through here to verify the fact that you are a state of Michigan resident. This works just like regular Medicare, right? Parts A and B. And we're going to get to the carriers here in a minute. There's a few that are participating here that will accept subsidy payments. And we're also going to talk about this 225% of the federal poverty level and what those incomes are. That's going to allow you to have this discussion with your clients. So here are the levels. And this is 225% of income is what the federal poverty level defines at. So we can see very quickly here, and I'm not going to spend a lot of time on this, and I'll certainly have these numbers available for you after we conclude the webinar if anybody has any questions. But one person, obviously 28,710, that's a pretty good number. So if you're in some of these homes with these elderly folks that may be single and or widowed that are on fixed pensions, fixed income, maybe just Social Security alone, this is certainly a discussion you might want to have, because in a few minutes we'll see what type of money we can get them coming back with a qualified carrier here to offset some of the premiums that these folks may or may not be paying. And again, Blue Cross has taken some rate increases, as have other carriers. And if you do have an opportunity to underwrite and move people, and they do qualify under these income levels, you can apply for this subsidy, and it will certainly help your client in terms of lowering some premium liability. So this is what we get, and it's age banded, as you can see. And if you start at age 65 to 74, we're going to get you $35 a month reduction in premium if you qualify. And remember, those numbers that we just showed you are how you're actually going to get there. And then when we hit age 75 or older, we actually get you $56 a month. So for the elderly clients that you may have, remember these age bands, and if you can think of somebody right off the top of your head that you know may have some income challenges, this may be somebody you want to visit to try and get some idea if they could qualify for this. And the Medigap subsidy also offers you under 65 with disability, and that's going to get you $110 a month. So significant premium reduction. I can tell you that I just quoted an under 65 disability Medicare supplement for somebody, and the lowest one that we have now, and not to digress here, but just so you know, Plan C is no longer available in an under 65 issue. You're now going to be going to Plan D as in David, which looks mysteriously like Plan N. So really a good plan, but that particular premium was $281. So if you do the math here, we're knocking it down to just a little less than $180 bucks a month. So that's a pretty good chunk of change, and I think your clients certainly would appreciate that. So here's our carriers. These are the only carriers that you can enroll a client with in the Medigap subsidy, both Blue Crosses, and we all know some of the Med Sups work out of both sides there, so that's the reason for the double listing. United Healthcare is participating, Priority Health is participating, and the folks at McLaren are participating as well. And I will tell you the McLaren Health Plan is the one that popped first when I quoted this particular individual in the under 65 arena, and again, it was $281 and some change. So if you're not contracted with any of these folks and you'd like to come on board for this opportunity and for some other ones, obviously United Healthcare we know has some very unique underwriting unlike anybody else out there and could afford you some opportunities here to maybe move some of your book. So please feel free to take a look at that. And as a caveat, United Healthcare obviously has lifetime renewals now since right around 2018, I believe. So some opportunity is out there, and certainly if you have those folks, please feel free to take advantage of that. So here's how we apply, and it's actually very easy. And when we get down into the slide deck here, I do have a website that you can go to, and you're going to see all the same information that I have here. It's a very well done website. It's got all the information there, all the contact information is there, and it'll walk you through, and there's a very good FAQ section in there as well. But you can see that there is an online version here. You can also print and fill out an app and send it to that address that is listed there. And again, you'll see that on the website address that I'm going to give you. And you can also call and talk to somebody directly down at the 866 number in point number 3 there, and they can guide you through the process and let you know what needs to be done. So after you've applied, you've put your paperwork in and everything is moving through, and your client gets a letter and says you didn't make it. These are some of the reasons that you're not going to make it. So take a look at those bullet points very quickly. And again, I'm willing to share this with you guys after the program here. Just give me a call. And also, for those of you that have never attended or were not familiar, give us about 48 to 72 hours, and we will have this uploaded on our YouTube channel at Insurance Advisors Direct, and you can watch this again and revisit anything that you'd like to confirm whatever it is the question might be that you're having. So you can see that there is a phone number where you can reapply, or you can call in questions with questions about the denial, right? So with that being said, most everybody that's going to do this, you should be able to pre-qualify them at the table by simply asking them a few questions. You know, what is your annual income? Those types of things. It's pretty straightforward here. So those folks that fall pretty close to that level, again, those are the ones that you may want to question further so we don't get their hopes up, and then obviously we get a decline letter 3 or 4 weeks down the road here. So let's take a look at some FAQs here and just kind of walk through this to let you know what the process and the procedure is. And typically when the subsidy starts, it's going to start the month after you're approved. So you're going to get a letter. So if you got it in the middle of the month, it's not going to go retro. It's going to fast forward to the first of the following month. And that's when the payments will start. And then if you're turning 75, the subsidy amount is based on your age when you apply for the subsidy. So for the bubble person at 74 or 75, maybe you're a month away from that 75th birthday, remember there's a much higher remuneration amount when you're in that 75 plus band, so you might want to hold off for a month to get them the extra dollars. And if not, obviously 35 is nothing to sneeze at, but there is an opportunity if you do have somebody on the bubble here to maybe help them even further, right? A question was raised with an agent here a while back, so I stuck this in here, and do you need to reapply? And the answer is no. Once you're in, you're in. They have you, and the subsidy payments will continue until the fund is exhausted. And then finally, what do you need? And it's basic information like we all know when we're filling out the Medicare apps that we all know so well. And also, again, they're going to want to know your current income. They're going to need proof of income because you are going to be asked, your client's going to be asked, I should say. And also, you need to make sure that one of the 5 insurers that I listed here in those previous slides are who your client is either A, currently with, or B, that is the application you have in front of them, and you're going to try and roll them over to get them re-underwritten and move them to a carrier that participates. So let's keep moving here. And this is, I'm going to leave this up for just a second and stop talking if you want to write this down. And again, we'll have this for you. But in the second bullet point there, that is the web address of the Michigan Medigap subsidy that we're talking about here. And again, everything you're seeing on this slide today, you can find at that particular web address. It, again, is very well done. It's very well laid out, and there's a lot of information in there for you to take a peek at. Okay, and with that, if anybody has any questions, please feel free to type those in. I do have a question here about how long is this projected to last, and right now they're saying through 2021. So we're still a good year to a year and a half in. Obviously, nothing lasts forever. It was actually projected to run out sooner than this, and whether there has been a lack of use or originally people coming out when the subsidy first appeared, there was some pretty aggressive application activity going in, and it may have declined, and people may have forgotten that this particular program exists. So for those of you that might have an opportunity here, again, please remind your clients that this is not a forever thing. It's going to be a temporary fix, but I think at this point, and especially in the current environment we're in, your clients are going to appreciate anything that you can do for them in terms of lowering out-of-pocket exposure to anything that they're currently paying for. So let me go back here and see if we have any more questions. And I do not see any. So with that, again, for those of you that want to contract with any of those carriers, if you're not, please feel free to reach out to me at Insurance Advisors Direct, and we can get that into your hands and get you moving forward ASAP. And please take care. Also, if you need a copy of this, give me a call or shoot me an email, and we'll be happy to provide the information that I have on these documents here so that as you move forward, you've got them right at your fingertips to assist your clients. So I do want to thank everyone for attending today, and it's been a pleasure, and certainly I am looking forward to seeing you all face-to-face here, hopefully very soon. So take care, and we will talk again shortly. And remember, we are continuing to do our webinars every Friday as time permits, and we're trying to bring you some interesting, if not updated information. And stay tuned, because as we move now and we come up out of the COVID-19 situation we're in, we're going to become very active again and get on the road, and you'll be seeing information and announcements about those programs shortly. So thanks so much, everybody, for being here, and take care.